Governments around the world are under increasing pressure to protect the most vulnerable from COVID-19. That includes those living in long-term care. In this country, there's been a staggering number of deaths in Canadian nursing homes, more than 1,500 in Ontario and Quebec alone. Prime Minister Justin Trudeau admits we can do better. He says help is on the way for a system that right now many say is broken. Dr. Nathan Stahl is a geriatrician at the Mount Sinai Health System in Toronto, and he joins us from there. Based on, or not from there, but from home, I guess, based on the data, we've so far seen about 65% of COVID-19 related deaths in Canada in long-term care homes. Doctor, what's your reaction to those numbers?
Well, it's absolutely tragic, but unfortunately, it's somewhat unsurprising. Canada had the benefit of having the separation of time and space when it came to this pandemic. We saw what went on in Europe, and unfortunately, we saw with similar devastations in their nursing homes there. Our homes here in Canada are no different, and the healthcare systems are first class here like they are in the European countries. And these homes are, the residents who live in them have comorbidities, they have a high rate of cognitive impairment, they live in congregate settings, and they live in settings that are unfortunately outdated with not a lot of access to expertise, and they sort of did not get prioritized the same way in our preparations like the acute and critical care systems did. So unsurprising, but tragic.
So the question is, have lessons been learned? Is there the will then, when this is over and done with, to make changes to ensure this won't happen again?
I'd like to think so, but we've seen other tragedies in this country in our long-term care system that we would have thought would have motivated change. The most recent being the Nurse Wet law firm mass murders. And unfortunately, we've just seen sort of the lack of regulation and oversight in our long-term care industry the same way we did following the Nurse Wet law firm murders. So there are many things we could do in long-term care to make this a safer and better place for the frail older adults who live in these facilities. Many of these facilities are built in the 70s, so they need to be retrofitted and updated. A lot of them have shared rooms, which contributes, shared bathrooms as well, which contributes to the spread of infection. There's huge issues with chronic understaffing, and staff are not paid sick leave and given benefits, so they have to work at multiple homes, and they may not be able to take time off work when they're sick. And quite frankly, they have not as little to no access to expertise for things like infection control practitioners. And when we talk about personal protective equipment, they were last in line behind the acute and critical care sector. So there's a lot we could do moving forward. Will we have the will to do this? Time will tell. I'm not so hopeful.
You've described a whole suite of issues, the comorbidity being the difficulty with the population, and then all the management issues, the infrastructure issues, etc. Is there an attitude that the electorate and that politicians should keep in mind when advocating for change around how the elderly live and how they're treated?
I think there absolutely should be. The question is, when was the last time you've seen a politician make care of the elderly or issues related to older adults a platform issue? I can't ever remember that, quite frankly. So even, here in Ontario, Premier Doug Ford, his mother-in-law is in long-term care. I don't think we were made aware of that until the COVID-19 pandemic surged, and it was discovered that his mother-in-law was in a facility that had an outbreak of COVID-19. So yes, I'd absolutely love to see that aging-related issues and those that affect our most vulnerable living in long-term care would be at the top of a politician's political platform. But I think we live in a society, unfortunately, that doesn't prioritize this age demographic despite all their contributions to our country.
As you well know, there are so many pulls on the healthcare system. We saw the debate earlier in this year in Ontario specifically around assistance for parents of autistic children. We have cancer, of course, the list goes on and on. So you're a geriatrician. What is your case for making care of the elderly a priority?
Yeah, so you touched on several other disease groups where there are advocates that are visible. The one thing about long-term care in particular is that these are a somewhat invisible sector of our population. 70% have cognitive impairment. They're housed in nursing homes where we don't hear or see a lot about them, and so they're not the first to sort of be in the front of the line or in the center of our society advocating for change. I think there's innumerable ways why this is important. Firstly, there's the old adage that a society is judged by the way it treats its most vulnerable, and the people living in nursing homes are certainly some of the most vulnerable in our society. So as Canadians, I think to be consistent with our values as a country, we need to treat this sector and nursing home residents with more respect, dignity, and invest in this sector. And the other thing, quite frankly, is that when you don't invest in a sector like this and you don't put money up front, we're seeing what happens now, where the downstream consequences are far costlier. So you have a higher proportion of individuals ending up in acute care. You're forced to now leverage other resources, whether it's the extreme of calling in the military or leveraging acute care hospital systems to try and buff up and support a sector that's crumbling. So certainly an upfront investment would pay huge dividends downstream and also be really the right thing to do.
So one final question for you, sir. So if I'm understanding what you're saying, if not for a variety of other reasons, sheer financial acumen might dictate that putting more money into this aspect could pay off and would make sense.
Oh, absolutely. I mean, the nursing home residents, even now, these are their homes, they still have extremely high use of acute care services, and they're frequently transferred back and forth between their nursing homes, emergency departments, and hospitals. If we could create a system where they got better access to care and better and more frequent and accessible access to this care, we could keep them in their homes. We could provide them with care that didn't lead to exacerbations of their chronic illness that lead them into acute care. And also, when you're talking about a pandemic like this, we're seeing just horrific numbers of homes being under outbreak, with spread that has significantly torn through these homes, resulting in significant morbidity and mortality. Had we been more prepared, had we seen what happened in Europe and stockpiled PPE for these individuals, protected the staff by enabling them to work in one home, and given them expertise in infection control and some of the expertise that the acute and critical care sectors have access to, we might not be seeing the devastation that we're seeing right now.
Dr. Stahl, I want to thank you for your time and your expertise on this. It's been great.
Thanks for having me.
Dr. Nathan Stahl is a geriatrician at Mount Sinai Health System in Toronto.